Welcome, and thank you for working with the Virginia Department of Health as we work to protect the public from pathogens through the use of vaccines. At the conclusion of the video, you will be able to list the 7 rights of administering medication, describe proper use of hand hygiene, describe how to select a needle and syringe for vaccine administration, describe how to prepare a vaccine for administration, describe the general vaccine administration procedures for vaccines administered to adults via intramuscular injection, describe monitoring adverse reactions associated with vaccines. Vaccination recommendations in the United States are made by the Advisory Committee on Immunization Practices, or ACIP. Recommendations are made based on scientific studies and clinical trials which examine safety and efficacy data. ACIP recommendations are formally adopted by the Centers for Disease Control and Prevention, and published vaccine schedules specify who needs what vaccines and when they should be given. Vaccines should only be given when indicated based on age and medical conditions. Route of administration and the interval between doses is critical to ensure proper immune response and maximum vaccine effectiveness. Vaccines administered incorrectly may not be counted as valid doses. This may result in the need for reimmunization. It wastes vaccine and patient and provider time, and may affect trust in the provider and willingness to receive additional vaccines. There are steps that are required before you administer a medication. It is important to obtain a complete immunization history. Accept only written, dated records, with the exception of influenza vaccine and PPSV23, which may be self-reported. Use recommended schedules to determine vaccines needed based on age, medical conditions, and risk factors. Screen for contraindications and precautions prior to administering any vaccine. Discuss vaccine benefits and the risks of receiving the vaccine and the risks of acquiring a vaccine preventable disease using the emergency use authorization information sheet or the vaccine information statement and other reliable resources. Provide aftercare instructions, including what to expect after vaccination. When administering a vaccine, you may be required to do a quick screening to make sure there are no contraindications for giving the vaccine to the patient. When administering vaccines, you should follow the 7 rights of administering medication. The right patient, have the patient state their name and birth date. Right medication, make sure you have the right vaccine. Check the vial and/or the syringe. Right time, make sure you are administering the right vaccination at the correct time, correct age interval, and before the product expiration date. Be sure that you have the right dosage and the right route, including needle gauge, length, and technique to include intramuscular injection. Make sure you have the right site. The deltoid is the preference for adults. You should never administer a vaccine in the gluteal area. And the right documentation. Document that you have administered the vaccine, including the name of the vaccine, date, and time, and if any adverse reactions occurred. Before touching the patient or preparing the vaccine, wash your hands either with soap and water or use a hand sanitizer solution. Hand hygiene should be performed before vaccine preparation, between patients, and anytime hands become soiled. Gloves are not required when administering vaccines unless the person administering the vaccine is likely to come into contact with potentially infectious body fluids or has open lesions on the hand. If gloves are worn, they must be changed and hand hygiene performed between every patient. Before administering the vaccine, you need to select the correct syringe and needle to be used. A separate needle and syringe should be used for each injection. A parenteral vaccine may be delivered in either a 1 milliliter or 3 milliliter syringe as long as the prescribed dosage is delivered. OSHA requires that safety engineered injection devices be used for injectable vaccination in all clinical settings to reduce the risk for injury and disease transmission. Personnel who will be using these products should be involved in evaluation and selection of these products and should receive training about using these devices before using them in the clinical area. Some syringes and needles are packaged with an expiration date. This can be a consideration when ordering injection supplies. Never administer vaccines from the same syringe to more than one patient, even if the needle is changed. Vaccine must reach the desired site for optimal immune response to occur. Use of longer needles has been associated with less redness or swelling than occurs with shorter needles because of the injection into a deeper muscle mass. Therefore, needle selection should be based on the prescribed route, size of the individual, and injection technique. A supply of needles in varying lengths appropriate for the facility's patient population is recommended. Usually a 1 or 1.5 inch needle is appropriate for adults. Typically, vaccines are not highly viscous, so a fine gauge needle, anywhere from 22 to 25 gauge, can be used. As with syringes, some needles are packaged with an expiration date. Check the expiration date on the needle and syringe packaging if present. Do not use if the equipment is expired. Once you have performed hand hygiene, you are ready to prepare the vaccine. Follow the manufacturer's guidance to mix the vaccine thoroughly and obtain a uniform suspension. Many COVID-19 vaccines are sensitive and must be gently swirled instead of shaken. Some vaccines require mixing with a diluent prior to injection. Whenever solution and container permit, inspect the vaccine visually for discoloration, precipitation, or if it cannot be resuspended prior to administration. If problems are noted, the vaccine should not be administered. First, flip the lid off of the vial. Clean the top of the vial to ensure that it's sterile with an alcohol pad. The cap on top of a vaccine vial functions as a dust cover. Once removed, cleansing the exposed rubber stopper with a prepackaged sterile alcohol wipe is recommended. Do not enter a vial with a used syringe or needle. Standard medication preparation guidelines should be followed for drawing a dose of vaccine into the syringe. A vaccine dose should not be drawn into the syringe until it is to be administered. However, in large vaccination clinics, syringes may be pre-drawn and labeled with the vaccine name, lot number, and the time the dose was drawn from the vial. Inject the amount of air into the vial as the amount of liquid that you're going to pull out of the vial of the vaccine. For example, if a 0.5 milliliter will be administered, inject a 0.5 milliliter of air into the vial. After doing that, flip the vial over and drop the vaccine dose. Make sure to remove all of the air out of the syringe. IM injections should be given in the deltoid for adults and older children. The vastus lateralis, anterior lateral thigh, may also be used, but this is not the preferred site for adults. To locate the deltoid muscle, visualize or palpate the acromion process and then measure 2 to 3 fingers down, which will put you in the center of the deltoid muscle. It is important to inject vaccines at a 90-degree angle into the deltoid. Because there are no large blood vessels in the recommended sites for vaccination, aspiration before injection of vaccines, pulling back on the syringe plunger after the needle insertion, but before injection, is not necessary. Also, some safety engineered syringes do not allow for aspiration. The following video provides further information on safely delivering an IM injection. It is important when giving an IM injection that you do not have your hand near the injection site, which increases the chance of experiencing a needle stick injury.
Welcome. Today we're going to learn the steps of giving an IM injection in the deltoid. First, perform hand hygiene with either hand sanitizer or soap and water. Next, you may use gloves, or per the CDC, gloves are optional, but you must perform hand hygiene and remove the gloves after each injection. Make sure that you have the right patient and the right medication. Prepare for a Band-Aid, gauze, and an alcohol swab. Explain to the patient what you will be doing. Make sure your area is clean, dry, and set up properly. Make sure your sharps container is within reach. Next, site the position of the injection. The injection should be given approximately 2 to 3 finger lengths below the acromion process. Have the individual roll up their sleeve so that it exposes the deltoid and you can properly site the injection site. Prep the site with alcohol and allow it to dry. Inject into the center of the deltoid in one smooth motion. Inject without aspirating. This is a vantage point needle, so as soon as the medicine is injected, you will need to depress the plunger all the way down to activate the safety device. Apply the Band-Aid. Dispose of the safety device into the container. Thank you for your attention as we work through this process.
After administering the vaccine, you should monitor the patient for any adverse reactions. Fear of injections is common. Syncope after vaccination is also common. Individuals should be instructed to remain in the vicinity of the vaccination site for 15 minutes or longer, depending on the patient's history of an anaphylactic reaction. Severe, life-threatening anaphylactic reactions following vaccination are rare. Thorough screening for contraindications and precautions prior to vaccination can often prevent reactions. Staff must have in place and be familiar with procedures for managing a reaction. Staff should be familiar with the signs and symptoms of anaphylaxis because they usually begin within minutes of vaccination. These signs and symptoms can include, but are not limited to, flushing, facial edema, urticaria, itching, swelling of the mouth or throat, wheezing, and difficulty breathing. Each staff member should know their role in the event of an emergency, and all vaccination providers should be certified in cardiopulmonary resuscitation. Epinephrine and equipment for maintaining an airway should be available for immediate use. After the patient is stabilized, arrangements should be made for immediate transfer to an emergency facility for additional evaluation and treatment. Let's do a review of what we have learned. Now you know how to administer an IM injection to an adult. Immunizations are the most effective method for preventing infectious diseases and provide a safe, cost-effective method to reduce the burden of morbidity and mortality caused by infectious diseases. Vaccination induces an immune response in the body for a specific disease-causing organism that allows the body to fight off infection if exposed to the organism later in life. Vaccines must be administered in accordance with ACIP guidelines that are approved by the CDC. Correct dosing and spacing are crucial to ensure optimal effectiveness. Each patient must be assessed for vaccination history and contraindications for vaccination before vaccines are administered. Follow the 7 rights and use proper injection technique to ensure vaccine is delivered safely and effectively. Although not covered in this training, it is important to store and transport vaccine properly to maintain their effectiveness. Thank you for partnering with us to protect the health of all the citizens of the Commonwealth.